Hello. I'm just going to provide privacy. My name's Selena.
Hi.
We're going to be doing a focus assessment today, and I'm going to be your nurse.
Sounds good.
I'm going to be looking at your respiratory system.
All right.
Do you have any concerns with the room? Are you comfortable?
Yeah, I'm comfortable.
Okay, great. Can I double check your wristband?
Uh-huh.
Can you confirm your name and date of birth with me?
Casey Phillips, May 17th, 92.
Okay, perfect. I'm just going to perform hand hygiene.
Okay.
And did you use the restroom before you came in?
I did.
Okay, great. So here is a gown I'll have you put on. Go ahead and tie it in the back.
Uh-huh.
Okay, and have you had any problems breathing lately?
No.
Do you have any pain when you breathe?
No.
Do you have a cough?
Mm-mm.
No? Have you had any respiratory illnesses or issues in the past?
Mm-mm.
What about wheezing when you breathe?
No.
Okay. And when you have activity, do you get out of breath easy?
No.
No?
Mm-mm.
Okay, great. So if the patient had reported any symptoms, then I would address these using Old Cart's ice. Okay, so let's begin.
Okay.
With our exam, I'm going to take a listen.
Okay.
So I've inspected the patient. Patient is sitting upright. Breathing is non-labored. The clavicle seems to be symmetrical, and the thorax is center, and the trachea is midline. So first, I'm going to take a listen at your chest here. You can go ahead and just breathe normally. Sorry, I know my stethoscope is a little cold.
No, it's perfect.
Okay, and now can you take a deep breath for me here? Okay, and exhale. And then one more here. Okay, and exhale. And then also, can you say 1, 2, 3 for me here?
1, 2, 3.
And then can you say 1, 2, 3 for me here?
1, 2, 3.
Okay, great. So I'm also going to take a look at your nails. We're going to put a pulse ox on you, which is to check your blood oxygen content. And I'm just going to take your pulse for 1 minute here, okay? So you can just rest. So you can go ahead and use your watch. Okay, so patients' respirations are 16 per minute, and the pulse ox reads 98% O2. Alrighty, so now I'm just going to have you face a little bit more towards this way because I'm going to assess your back.
Okay.
So the anterior thorax of the patient was all within normal limits, and vocal fremitus was present and equal bilaterally. Alrighty, so here I'm just going to do some palpation. Do you have any pain?
No.
Let me know if you have any pain where I'm pressing. Anything there?
Nope.
Okay, what about in the front here?
No.
No pain here?
No pain.
Okay, and then anything along the trachea?
No.
Okay, great. So patient reports no pain, but again, if they reported symptoms, then I would use Old Quartz ice to assess. Okay, so now we are going to take a listen. All right, can you take a deep breath for me here? And can you say 1, 2, 3?
1, 2, 3.
And then another deep breath for me here. And can you say 1, 2, 3?
1, 2, 3.
Perfect. So the vocal fremitus on the posterior thorax is equal bilaterally. The patient's scapula are also equal bilaterally and has muscle tone within normal limits. The spine is straight and the costal angle is 45 degrees. And that concludes our exam. Do you have any questions for me?
I don't. Thank you.
Okay, great. Goodbye. Goodbye.